Hi everyone, I'm Dr. Niranjan, consultant nephrologist from Mysore. You know that a lot of people who go for gymnastics have a habit of consuming the supplements to build their bodies. Today, I would like to give some valuable insights about the consuming the supplements and also the kidney health. A terminology called the gym nephropathy, in which people who consume the nutritional or non-nutritional supplements to build their bodies, which can cause the kidney injury or kidney failure, is called the gym nephropathy. So essentially, I'll be talking about only the five the supplements being commonly used. One is the anabolic androgenic steroids, creatine in powders, high dose vitamins, high protein intake, and energy drinks. So, if you look at the anabolic androgenic steroids, many individuals who consume for a longer duration can land up with the kidney problems. So, a cohort of 10 bodybuilders have been studied in US by Herlitz et al. And they found that it can cause the out of 10, 9 patients kidney biopsy showed focal segmental glomerular sclerosis. In this FSGS disease, they'll have a leakage of the protein in the urine, swelling of the limbs, and puffiness of the face. All these things as a part of nephrotic syndrome. And also, it can cause the cholestatic liver disease, in which the bile acids will be increased, and these bile acids can precipitate in the intratubules of the kidney, and that cause the bile acid nephropathy. And this anabolic steroids can also increases the thrombotic risk as well. So it causes the increased platelet adhesion and aggregation, as well as the increased procoagulant factors in the blood, and decreasing the lysing capacity of the blood, leading to renal artery thrombosis as well. There are some case reports of all these renal artery thrombosis as well as bile acid nephropathy. Of course, many individuals also have a habit of taking the testosterone, growth hormone, insulin, and stuff like that. But I'm not discussing all those things. Just I'll be concentrating about the commonly used stuffs for by the gymmers to increase their the muscle mass and the body size. So the second the supplement commonly used is creatinine. Creatinine is generally safe, but however, people who consumes in a higher quantity can also have acute kidney injury, and an RCT has also been done on this, in which people who have consumed 20 grams of creatinine for 5 days, followed by 5 grams for next 3 months. Generally, they are tolerated well and no much involvement of the kidney. But in other individuals, people who consuming this creatinine powder, coming with the kidney problems and kidney biopsy showing the acute interstitial nephritis and acute liver necrosis, all these things have been described. So you should be cautious when you are taking creatine powder as well. So are the vitamins are really safe? Of course, if you are taking it a recommended dosage, it is safe. But many gymmers, they take the vitamins in a high dose. There are reports in which people have taken the high vitamin D, that is 50 ml of vitamin D injections, having the high concentration of 50,000 units per ml of vitamin D. When they take such a high dose of vitamin D, it can cause the kidney stones, hypercalcemia, and also the kidney failure. So the some patients who have this high dose of vitamin D intake and the kidney stones or the kidney problem, they underwent a kidney biopsy showing the interstitial fibrosis, tubular atrophy, and also the calcium deposits in the kidney. So when you're taking vitamin, it should be in a normal recommended dose. And some individuals also have a habit of taking the high dose of vitamin A, the E, as well as vitamin D. A combination of all these things can also put the patient at risk of the kidney stones as well as the other kidney problems. So, are the protein is really safe? Yes, of course, when they're taking in an adequate dose as per the recommendation. But even the International Society of Sports, the medicine, what it says is can take up to 1.5 to 2 gram per kg per day. Generally, the people will tolerate well, provided the patient have normal kidney functions. If it crosses more than 2.5 or 3 gram per kg per day, theoretically it puts the kidneys at risk, because when the proteins are taken in a higher quantities, the kidney has to filter more. So the glomerular hyperfiltration injury will occur to the kidney. And if a patient is already having a kidney problem, the high protein intake will definitely worsens. It accelerates the chronic kidney disease. risk of developing hypertension. All these things come into picture. So when you're taking a protein, see that your kidney are functioning normally, and keep a watch about the renal functions without taking high dose of protein. And if you come into the energy drinks, the generally it is safe. Many people take the energy drinks prior to the workout or prior to the gymnastics. But it's generally safe, but the FDA has reported around 166 adverse events. In that, about three people had a acute kidney injury. So even the energy drinks to some individuals may cause kidney problem. So always think before you consume anything. Think before hitting the gym, and have a very healthy kidney. Thank you for patient listening. Have a good day. Thank you.